quorum. Yeah. So please go ahead. Give us your background. Give us everything that you want, and we'll be happy to share with the rest of everyone that comes along.
All right. I would like to say thank you for this privilege. Israel Health Center is honored. I've worked with them for 3 years now.
Yeah.
And although the place is a rented place, it's under the government. And then the assembly pays annually for the place. But recently you realize we need a facelift. Last year, we, the nurses and midwives, contribute with our own money. You know how salary in Ghana here is. But because we also want a better place for our clients and patients, we contributed money and painted the place. But as I'm talking now, still the place is not the best. We have most of our river blades broken and nets destroyed. So even if you go to work in the night, you tend to have mosquito bites and all that. You don't even have a generator. And it's all a worry. And then there are instruments and other equipment that we need and we are not getting. As you first said, you write the memo you write, but the response. And we are a lot. Everybody needs attention. So before to even as I'm speaking to you right now, the whole facility, we are using one BP machine because most of the BP machine that we had are sports. So if I'm having a client, sometimes I have to walk to the OPD, go for the BP machine. The moment I can have to return it because another person also needs it. And it's all a worry. So whenever we hear of people trying to give out, it's always excited that we should also come before them and lay our worries with them. Because you working, you want to save life. But at the end of the day, you are risking your life to save another person's life. And sometimes if it's not for the passion or the love for the work, you must not, when going to work, you feel like after all, if I get to the work, I will even get the needed item that I need to work with. Last 2 years or last year, we had sorry. We had one NGO called the Blessed Charity something. If it was a page that I pleaded with them, if not anything, they should get us a Doppler. Because we were not having, we're still using the old one, the prenup that you burn with it to listen to fetal heart rate. And we have only one. So imagine somebody is in labor and you are having an ANC consultant. You have to rush for the person at the labor room to also have the use of it. And God being so good, they came to our aid and they gave us the Doppler and some bed sheets and nose mask. As I'm talking to you now, that's the same Doppler we are using. We have only one. And because it's only one, now it's faulty, but we are trying. We don't have any option than to continue using it. So that's what we have been using for the past 1 year now. And it's only one. So if you are in labor and I'm having a client at the ANC, I will use it after. Then my colleague will also come and pick it up and go and use it at the labor room. Sometimes people come in and they are like, are you sure this place is a government facility? Anyway, yes, it's a government facility, but we are not getting what we need. We have write memos upon memos. Sometimes the directors will come around and they blame us as if we are not doing our work, we are not doing our job. Meanwhile, you are blaming us, but the necessary things that we need, we are also not getting. And sometimes it's like wasted efforts. You are not getting what you need, and you think you are putting in enough effort. But at the end of the day, they make you feel like you are doing nothing. Like they see no use of your stay over there. And it's very painful. So I personally will be very grateful if you guys could come and help us. I feel like even sharing tears is not that like I'm exaggerating, but looking at the situation there, it's not the best. It's not the best. It's not the best. Even our labor ward, the delivery card, for instance, is very small. Sometimes when the client is big, you have to find ways and means of delivering a baby. Sometimes you even have to do the delivery on a bed. At the end of the day, waist pains. It's not easy at all. It's not easy. And when you complain and it seems like you are always complaining, Right now, if you go to my workplace right now, you realize the whole place is bushy. They will tell you there's no money. So if it's a worry to you, then it means you have to contribute again and find some laborers to read the place and pay them. How much is my salary? I'm a mom and you have to help too. So must we always sacrifice our ad and the small salary they give us to do things on our own? We were not even getting, I don't even know if Nana will recall. I pleaded with him to get us a sterilizer because we were not having. But God being so good, now we have that one, so we have been able to sterilize our instruments. But how many instruments do we even have? I've been there since I came to the place 3 years now. The old items that are there are the same thing that we are using. It will get spoiled, you request for, you still not get it. So you still have to manage the one that you have. So please let me bore you with our issue, but it will be really, I'll be really grateful. And then all the facilities, I think all the staff, OPD, public health, and every other unit will be much appreciated if you come to our aid. I know it's not easy anywhere, but Israel Center, we are suffering. We are really, really suffering. Because in where will you find, as a nurse, you are being posted there to work, and then you end up using your salary to improve the place. It's not the best. Because even sometimes those paying, they'll be complaining. And how much do they pay me? But what do you have to do? We have to fight for the place, because assuming it's your relative coming to the place and the place is not nice, the person will not even come. And day in, day out, the district too, they want their numbers. They want attendance to improve. But all these things amount to that. If I come to your workplace and the place doesn't even look like a health facility to me, I won't come again. But it's not our fault. We are really trying. We are really trying. As I'm talking right now, our tap is not flowing because they said we are owing you some of amount. So we now buy from water tank. Then they'll come and pour into our tank. And then we will fetch like a row into our Veronica bucket and then to the various washrooms. So imagine at a health center, water is not flowing, you have to go and fetch. And then, so even if somebody use the washroom, you have to go and fetch water and come and pour. So if the person refuse to go for the water and come and pour, you end up go to the place and the place will be messy. If the water is flowing, the person will just flash and that's it. So these are all challenges that Israel Health Center is facing. Thank you.
Wow, thank you. I think that really correlates a lot with what Nana was telling us. Okay. There are certain questions that I have. Essentially, can you kind of give us a background of the Israel Center? It's supposed to be a CHIP compound, correct? So essentially, it's a government satellite facility for the rules place. Okay.
So like it's a small community, and then a health center is advanced than CHIP compound. With CHIP compound, the place is usually, it could be like a self-contained, maybe 3 bedroom, and then it's being used for a CHIP compound. And they don't have lab. So the difference between a CHIP compound and health center, with health center we have lab. We run labs at the place. But with CHIP center, they don't have. So my place is a health center because we have access to lab. We have a physician assistant being the head. We have our OPD department. We have our maternity units. We have public health. We have mental health units. And then we have the family planning. So we are running as a health center and not a CHIP compound.
Okay, got it. Okay. And how many people, I guess, or healthcare workers, do you have at this facility? And I didn't hear anything instead of a physician.
Yeah, we used to have 2 physician assistants known
Okay.
as the PA, but at
Okay.
the moment we are having one. So she is doing all the work. We have one. And then, like the whole staff together with the PA, I think we are 30 or so, if I'm getting it right. Because maternity, for instance, we are 8. We have 8 midwives. And then I can't really tell for the OPD and the public health, but I know When we sum up, we are around 30 plus.
What is OPD?
Outpatient departments.
Okay.
So when you visit a facility, the first place you have encounter with.
Got it. Okay. Okay. And what type of patients are you treating primarily most of the time? What kind of diseases are being encountered in this facility?
And so we are open to all manner of diseases. When they come and it's above us, we refer. So being it chronic, acute, wound dressing, whatever, we attend to you. So it's like we are being the first aid of the community. When you come and we'll be able to treat you, why not? We go ahead. But when we can't, we'll give you your first aid and then refer you. We have bed that we detain patients. We run labs. If we need to if we need to transfuse you with infusers, we rightly do that. And then we monitor you for a while. If you are okay, we will discharge you. But when the condition is beyond us, we refer you to a bigger facility.
And what is the nearest biggest facility? Because from what I understood was the tertiary center is the one that's in Accra. So is that where they go?
We are in Accra.
Okay.
We are in Accra. So we have Ganot. It's quite a distance, but when it's happening that way, you don't have a choice. So we have Ganot around. We have Achimota Hospital. I don't know where before leaving Ghana if you heard of Amasaman. That's Ga East.
Okay.
So we have bigger government hospitals, just that they are a distance from where we are to the place. But when the need arises, the person has to be taken through maybe public transport to the place. I quite remember I was once attending to a pregnant woman who was in labor, and then there was fetal distress. So I need to refer. And in this Ghana, if you want ambulance, when you call, the first question they will ask you is the client willing to pay for the service? If no, then you are on your own. So we have to take taxi. We get to Amasa and we were told they are also having similar case. There's no doctor. So we have to move ahead to regional hospital. That's Rich Hospital. And that's where she was taken. And God being so good, she delivered her baby safe and sound.
So the ambulance is not a complimentary service that the hospital offers. The client actually has to pay for it.
Yeah, you pay for it. Whenever you call for an ambulance, the first question they will ask, are you really ready to pay for the service? Because you don't have access to an ambulance. So that's the first question they will ask you. But the bigger facilities, now, most facilities have ambulance, not if they don't have it, one. So such places, even that one, they will even talk to you because they will tell you they use money to fuel those vehicles. So I know it's not free like that. But we don't have at all. So when you call, they will ask you if you are ready to pay the charges. If yes, they will just come around. If no, then you have to find your way out.
Do you know what that normally runs for a transfer to a tertiary center?
Please come again.
Do you know what they typically charge for that when you're trying to transfer somebody up to the regional center?
Oh, it used to be 300 cities, but I don't know for now.
And how many people can actually afford that?
Exactly, because even sometimes when you telling the person I'm referring you, they are even thinking about the money. Because some facilities, when you are being referred to, based on the letter being written, they also want to do their founders. So sometimes they will repeat lab, they will repeat scan, and you are going to pay for it. Insurance doesn't cover scan. Even with lab, it's sometimes the insurance will subsidize the amount, the actual amount you have to pay. Like maybe a pregnant woman has walked in and you have to do the routine labs for her. If she's insured, she will pay 100 cedis instead of 1.5. So even if she's having the insurance, it's still not free. It's just taking part of the money from it. But sometimes this politician will publish it as if everything is free because you have insurance. Meanwhile, that's not it. When you're on the real ground, you have to pay something.
Now, from what I understand, the insurance in Ghana is a social system, correct? It's open
Yes.
to everyone. So therefore, um, everyone should basically have the same access to services for the most part. Okay.
Yes, please.
So wherever you go, you can be seen, and whatever you need should technically be done.
Exactly. That's how the insurance runs because it's owned by the government. So
Okay.
what you as a citizen need to do is you need to renew it annually. And when you go to the hospital and it doesn't cover certain medications, you just pay for it. But it's when it covers, you are free to go.
Okay. Understood. Okay. Got it.
Like Ganoff, for instance, when you are insured and you even spend like 1 month over there, you only pay 20 cedis for the bed. All the days you spend there, you only pay 20 cedis for the bed because you are insured. And then apart from that, any medication that the insurance doesn't cover, you will pay for it.
Okay. Can you give us more rundown on the Israel Center? How do people get assigned? How do healthcare facilitators get assigned there? I mean, how do they dole out the distribution? Especially, I'm guessing from what I was told as well, the government has nursing training centers or right? And then there are other
Yeah,
private facility nursing trainings as well.
yes.
The
So
understanding was, yeah, go ahead, please.
In Ghana here, we have the government institutions that train nurses and midwives. And then we have other private facilities that do same. So the difference is when it's time for posting, government will post people that are being trained under him. So me for instance, I was trained under government institution. So when posting were open, the portal was open. It was open for people who have been trained by the government. They will be posted first. Then after the government will come and look out for the private sectors too. But now it's like the nurses and midwives are more than uh, people governments are posted. That's why most of my colleagues are living outside because I have people who are at home currently not working because they have not been posted. So it's government who is supposed to post you. So Israel, for instance, is under government. You can't just work from anywhere and get there as you want to work. No, you have to pass through the process. You have to be posted by the government. And we have a district. So you first go to the district and then they will look through where there is loopholes. Oh, okay, Israel is not having a midwife. So you have brought in your letter, fine, you have been posted to the central, but we are taking you to Israel because we lack a midwife. Then that's where you'll be posted to. So it's cut across. Before that, a portal will open and then you enter your information with your results. And it's basically the portal opens with regions. We have the whole of Ghana, the 11 regions, the 16 regions that we have. Every region is there. So when you enter your region and you are fortunate to get Accra. Even in Accra too, we have a lot of hospitals, health centers around. So the directors are those who will post you. Governments have opened the portal, you have entered, you are taken. Okay, now your posting has come. So you send your letter to these bigger places and they will look through the health centers and clinics under them. Where there's loophole, then they push you there.
So the other question I have is, so the physician's assistant that is there, you said there used to be two.
Yes.
What happened to the other one?
She's on study leave. She's going back to school to study.
Oh, got it. Okay, got it, got it. Okay, okay. And do they feel equipped? Do they feel adequate to be able to handle everything that goes through there?
It's like we are all managing. We are all managing because we don't, as I said earlier, most of the things that will make working easy for us, we are not getting it. So each and everyone is working. Sometimes the current fee, even to go on leave, is a problem because if she's not there, and even if she's at the house, we'll be calling her. PA, somebody has come with this, what do we do? So she's not even enjoying her leave
Okay,
because most of the time she's in the house, but we still call her.
okay, okay. Understood. Okay. I think we have another person, Dave. I don't know. Is that a colleague of yours?
No, please, but he's part of my next team.
Oh, got it. Okay, gotcha. Understood. Okay. Well, guys, do you have more questions? I think I've been taking up a lot of space, so please go ahead.
Yeah, one of the questions I had is, kind of going back earlier in the conversation, you were discussing allocation of resources. How does the government determine allocation of resources? So, for example, if you need new equipment or whatever, are you based on an annual budget that's fixed, or is it based on number of patients that you're taking care of annually? How do they determine how much the facility gets?
So we have the records and then the accounts. So each person that works through the facility at the end of the day is given a receipt. And with the receipt, there are numbers attached to it. So at the end of the year, the facility knows that, okay, we were able to attend to 100 patients. And this 100 patients, we were able to generate, let's say, 1,000 Ghana. Okay, and you have brought in a list of things that you need. So the money that the facility is generating is the money the government is going to use to better the place for you. And looking at our place, it's a small place and we don't get much of clients. So at the end of the day, our monies are always small. It's not enough. So always when you write something, they'll tell you don't have enough funds. And sometimes, unless maybe there is some donation across, and then they will share, and each and every facility will get something little from it. Other than that, it's the money you are generating that they are going to use for your place. So if you are not getting enough, it means certain things you write to and you won't get it.
Okay, so a follow-up question to that then. Because if I'm understanding you correctly, it is based on the services that you end up being able to provide over the last year. What would you see as the biggest holdup to getting more people through your facility? Because, in my mind, if we can improve the facility in a way that enables you to take care of more people, then we're essentially doing more than we could do by ourselves, right? So because then you're able to bring in more revenue, and then the government funds you better, and so we're kind of multiplying our effect. So what would you say is the biggest holdup to getting people to come to the facility? And I guess you kind of touched on this earlier, but I just want to make sure I understand it. It sounded like the look of the facility seemed to be one of the big things you were pointing out as a concern.
Yeah, exactly. The place doesn't look its best. And you see, people have preference. We are not the only health facility running. So the person will visit your place and the place doesn't even look well presented. They will go and then they won't come back. But if all these issues are solved and when they come, whatever they need, we are being able to attend to. I don't think they will even feel shy coming to the place or telling somebody this is where I attend my health care. But because the place is not the best, so that one too is a huge hindrance at attracting clients to us. So if something will be done about it, I know many people will be coming because where we are the government health center around. Any other place around is private, and our services are cheaper compared to private. But the place is not looking the best. Meanwhile, we have the qualified doctors, midwives, and nurses working over there. So we just need a facelift of the place, and I know by God's grace things will change.
I think we got estimated. Oh, I'm sorry. Go ahead. Was someone talking?
Oh, I'm wondering how many patients see in a year's time.
Please come again.
How many patients are you servicing in a year?
I don't want to give wrong answer, but I don't know if my PA is on it. Maybe she can help with that answer. And if possible, if you can't get it now, we'll get it for you through message. But for now, I don't have it off head.
Yeah, that's fine.
Yeah. The labor department, you primarily work in the maternity department. Now, from a lot of what I had read, as well as kind of gone through and perused through the some of the primary data in the literature, as well as kind of talking to some of the other people. One of my mentors, name is Dr. Opoku. He works at the Confinachi Hospital, and he's part of the medical group there, as well as the medical school there. Um, it seems like the mortality is actually quite similar to what we have here in the United States, bordering around maybe 25 to 30%. Of mortality. Well, can you comment on that? Is there is there a lot of education with the populace, or is there kind of a lot of resistance when come to trying to teach them about some of the things that need to be done even before they get pregnant? You know, also,
Yeah.
yeah, some
So, like, it was what you are saying was a worry. So, what the government did was, okay, let's introduce pregnancy school. So, during pregnancy school, we talked about every trimester and what the pregnant woman is to expect. And then we give education and the signs, the danger signs that when you see, you should report quickly to the hospital for you to be attended to. So if you look back, you realize that now maternal mortality is on the low as compared to first. First, it was really high, but now it's on the low because there's more education going on. And now we don't wait for the things to escalate before we give attention. The moment you realize it's going bad, if you know you can't attend to, you refer to be on the safest place. You refer to a bigger facility which can handle it better than you. So concerning maternal mortality, God being so good, my 3 years working with Israel, we have never record one. We have never recorded any maternal mortality and any stillbirth. We thank
really?
God for that. Yes.
Okay, that's fantastic. Especially given the limitation of resources. That's really
Yes.
good.
Yes. We do try our best.
Okay.
That's why I said earlier that we risk our lives to save lives.
Got it.
And that's what we are doing.
Okay. How does the populace, I mean, because I know, even though this is in Accra, I'm guessing, again, can you kind of give me, geography-wise, this is probably more rural Accra, I'm
You said
guessing? Is this more rural, like it's more in the country, is where you guys are, or I don't know exactly. Accra is a big enough city itself. I thought Accra was the capital. So where are you located in comparison to the main city?
Yeah, Accra in general, you heard of Accra. Accra in general is the capital
Right.
of Ghana and it's a big place. And we have sub areas across.
Okay.
So you get a small, you are in Accra, all right, but there are a lot of places.
Okay.
Like you be in, you see, with the foreign countries, maybe where you are in California and then the California is a whole city on its own.
Okay.
Then you can move to another place.
Okay.
So it's something like that. We have the Accra as the name, but we have a lot of places across, but we are all in Accra. But the names changes. The name of the places changes. So although it's in Accra, you can get Santa Maria. It's still under Accra. You can get Sotium. It's still under Accra. So we deal with the districts.
Understood. Okay. So how does the population around there respond to the education that you offer? Like, how do you guys actually do it? Do you go out and actually like door to door? Do you send pamphlets or letters? Do you get like a forum together where you get people to come to these things? How do you actually talk to them?
So like with the public health aspects, sometimes they write to schools and churches. So when they are going, ideally a midwife and a physician assistant, if she have enough time, she will follow with them. And then I know recently there's a school around. She was part. She was part. So when we go, we give the health education, and then we also advertise our place. So in case people come to us, when you visit our place, when you are pregnant, so you get your education. When you are also not well, you still get your education because we have the PA around to help, and then we have the nurses also there to give you the education. So basically, we go out and also do some at the facility.
We've got another person here. Ma'am, with the glasses?
Hello, I'm Howard.
Hi. Yeah, please introduce yourself. I didn't mean to ignore you. I apologize.
Oh, that's fine. I'm Howard, how are you, sir? The head of facility at Israel Health Center.
Okay.
Sorry, I'm joining it late.
No, it's okay. Please, thank you for your time. Thank you for making time for us. I'm Francis Essien. I was born and raised in Ghana until I was 9, and then I've been in the States most of my life since then. I'm 52 now, so I guess 20 some years now that I've been away from the place.
Okay.
Yeah, I'm somewhat well up to date because my mentor, Dr. Opoku Wame, he still lives down there, and he tells me a lot of what's going on. So hence why I'm the executive director for our not-for-profit. And then you have my colleague here, Dr. Brian Grooms, who is also part of our not-for-profit. He's the secretary. And then Dr. Gertson was on. I think he'll be back. And so, yeah, please tell us about yourself. We've had a lot of great with Regina here. She's been fantastic and has given us a lot of things, which honestly has been very eye-opening. So talk about yourself and give us your background and how you think that we can help you to do what you're doing better.
Oh, okay. I think I got to a point where she was talking about the facelifting of the facility. Yes, that has been a major challenge to our facility because initially the road leading to the facility wasn't tiled. So it's discouraged a lot of people from coming to the facility. But with the help of the assemblyman, we're able to talk to the MP, and now they are working on the roads. So it has left a lot of dust on the surface of the walls. So currently we are trying to see whether we'll be able to facelift it in order to draw attention to the facility. And also I think you asked whether the facility was in a rural area or it was in the city itself. Greater Accra itself is a big city, but where we are, the community in which we are, the occupants there, they are not really doing well in terms of finances. So if you compare our services to the rest of the facilities outside the district, you realize that we have to bring down most of our prices just to meet up to their standard of living. And then, so we end up even running free services. Regina can attest to that. You normally pay for their deliveries because they come in, they don't even have the items for delivery, the basic care, some labs, we have to lift them off. So these are the few challenges that doesn't really help us accumulate a lot of money in running the facility. And also we are trying our best. We are trying, as she was saying, we normally go into the community. That's the public health unit and then the maternity unit. So it's in turn bringing in a lot of clients to the facility. We offer school health, we offer health screening. Last year, for instance, we had the school health and then we offered some health screening to them. So it's also aided in the numbers. Currently, we are trying to partner with UNDP and then PATH on the non-communicable diseases. I think they selected our district and then some other districts. We are trying to bridge the gap between healthcare from the community and then to the facilities. Sometimes when we go into the communities and then we do their random BP checks and sugar checks and it's high, we direct them to the facility. But most don't come. They are discouraged. They don't come because maybe they don't have the funds and everything. So we are trying to bridge that gap where we can take the health to them, even if they are not coming to us, and then record our data accordingly. So currently, that's the plan we are trying as a district itself, not only my facility, but with the directorate itself to bridge that gap. Because they want to, but I don't know, for some reason, they don't really do that. We are also in touch with some of the churches and the mosques around to offer free health talks to make them know of the dangers involved in some of these non-communicable diseases. Because mostly they don't really come with symptoms and signs. They present at the later parts. So we want them to access the facility as early as possible so that we can be able to detect the illnesses early and then give them the appropriate treatment. She was also saying something about the referral system. Initially, it was quite difficult to refer these people because they see that our prices are okay. So when you're referring them to even the bigger facilities, which have a higher price range, they get discouraged. So with the help of the health insurance, we are hoping that things get better in terms of the quality of care and then the medications. And also we are linking with some of the ambulance services around us to make the transportation of those who are not stable and very unconscious or weak patients quite easy. All these are things we are trying to do just to encourage continuity of care. Yeah, so currently we are doing a few things to get there, but we are hoping that with time we'll get the needed.
Yeah, that was fantastic. Thank you very much. You hit on everything that we've basically been we've read and or really wanted to help with. The first question, the facelift that you keep saying. So the building itself, is it that it's dilapidated? Is it just it's kind of broken down and it doesn't look good? What is it that you primarily say when you mean facelift?
Oh, okay. It's about the painting. It looks good. It's in great shape, but
Okay.
it's just the painting.
Okay.
One challenge we faced with our facility that I think didn't make us do the facelift early was because, you know, that in Ghana here, it's very hard, especially for health centers, to be an owned like facility for the government. Normally, it's the assembly that takes care of the building itself in terms of paying the rent and ownership. Some are fortunate enough to own the places, but for us, it's a rented place.
Okay.
So we renew our terms as and when it's almost done. So initially, I was discussing with Regina earlier. I was telling her she knew you people, but I'm not. But so I wanted to see how best you could help us. So I initially discussed with her whether there was a way we could suggest to you, just in case you speak to your friend or daughter friend, whether you knew whether we could get a permanent place. That's really one of our major concerns because when investors are coming, they want a place that is very long term. They can come years back and then they are like, I was part of this project. But then fortunately, where we are, it's a good place, but because it's rented, when you go out there soliciting for those permanent structures and other things, normally people are not really willing to invest in because there's a possibility you could move to another place.
Wait, I thought this was a government facility.
Yes, it is, but it's not owned. As I was saying, for Ghana, it's not all the facilities that are owned. Like the place, the land and everything, title and everything is in the name of the government. No, you rent it.
Right.
Okay.
Yeah.
Okay.
You rent it for a long period of time.
Okay. Wait, so
So
who's
that's
renting? The government or you are?
No, the assembly through the government. The assembly is the intermediary between us and then the government. So they solicit for funds for that. That's part of their responsibilities.
Assembly. What is the assembly? Is that like the
Also,
committee?
no, they are the legislative. How they the executive part of the government. They work with the MPs, the ministers. So
Okay.
after the ministers, we have the assembly. And then the DC, the district, so they work on that for all the facilities across the country.
Okay, yeah.
So some are owned, others are built by the government, others are bought, but some are rented, and ours is also part of the rented facilities.
Okay.
So the facelift was just the painting, not that we have a place that's dilapidated, sorry, but there's mostly about the painting of the facility to give it a new look.
Understood. Okay. Sorry for our ignorance there. I fully misunderstood.
Oh, it's fine.
Okay, got it.
It's
So then a more permanent building would require basically a purchase of land and build a structure?
That is also one part, and there are also some nice buildings that are already built that are being sold.
Okay.
So these are the two options. You either get the land and then build it yourself, or you find a place that is suitable for your, let's say the rooms are in accordance to the number of departments you have, and then you buy the building at your home. Or you rent. These are the three options the government has. They either build from scratch, buy a building, or they rent long term for the staff. So these are the three main.
Okay, got it. Okay. Do
Couple
you
of
have? Sorry, go ahead, Brian.
no, you're good, Frank.
Yeah.
Just a couple of quick questions
Okay.
following up on this line of questioning. One is if you were to buy and or build a facility, does the government have any limitations on you doing that with funds provided? Meaning, are they going to have a problem with that? Or
No, I think
red
the
tape?
only no, they don't have a problem with that. Ideally, they always, almost after their every meeting with them, advise us to go and look for stakeholders to help us. So we just have to just inform them through formal letter writing and all that, that this is the intention of maybe a stakeholder that they are planning on getting us a place. But I don't think there's any legal problem or any professional problem to that.
The other question would be the current facility, if we were to do a facelift in that place, I assume you would have to go through the landlord to get that approved.
No, with the facelifting, anything that doesn't come with building anything attached to what they have. So let's say for painting, renovating the roofs, those are things you don't discuss with the landlord or anything. But let's say you are trying to build something on the land that you need their approval, and mostly they don't allow it. So we go with that's why you're on the safer side of just choosing the painting, the facelifts, and that's all.
Okay, thank you.
You're welcome.
So, in your opinion, what is more efficient to buy and find a new place and buy, or would the landlord just be willing to also just sell what he has here? Or
Currently, our landlord, I doubt he'll be willing to, because apparently it's a family
no?
building, so they want. So getting a new place, like buying it, will be the appropriate. But for them to sell to us, I highly doubt that they would want to. I doubt that.
Okay. Is there a place that you've located that would also be able to provide the same services and close?
The one we had, I think that was last 3 months ago. A church came to buy it, so
Okay.
you'd have to look for
Okay.
other places. As at now, we don't have a current. The one we had 3 months ago was bought by a church, and they've already started their congregation, so we'd have to look for.
So that's one priority, is finding a more permanent place in order to provide services. And then,
Yeah.
then services wise, what are the biggest needs? Regina was already gave us a kind of a rundown of some of the maternal issues, as well as, equipment, facelift, as you said. What are the other biggest needs that you feel the facility needs to provide in order to attract patients? Because I guess also background, what is the economy there that is, I guess, allowing them to even have access to finances, the population there? What is the economy like? Is it farming?
Most of them are traders. Most people in the community are traders. And these are some, let's say they are a couple, maybe just the man is working and the woman is at home. So the economy in the community itself is not that active, if I could use that word. It's not really an active place. Yeah. So most of the services, it's almost like you're running this for free, because you need to take care of them, but then they don't have the funds to
Understood.
pay for.
So what are the other services, like you were mentioning, the non-communicable diseases, which is our primary function? All these chronic diseases chronic disease itself can sometimes be a good indication of a population also, expanding beyond what's obviously the environment allows in terms of growth. But what are the big chronic diseases that you also need assistance with at the moment in trying to engage the population in?
Okay, at the moment, what we are really facing with in the district itself is the high incidence of the hypertension and then diabetes. These are the two main chronic illnesses that are very rampant. And mostly when they come when they are in very severe cases. Though we go around sometimes, but one of the things that would really help us now is the SFIG manometers. Because normally as a whole facility, currently we have 2 working SFIGs. So you can see we have the maternity, we have the public health, and we all share the same thing. And now we have to go into the community to check their BPs. We will have to take one out of the 2, and the whole facility will be running on just one SFIG. And mostly sometimes they become faulty. We used to have a lot, but because of the pressure on the few, they spoil quite easily. And the glucometers too, we have only one at the facility. So you can't even take that round to do your random blood sugar tests and all that. So these are the 2 main chronic illnesses are the diabetes and then the hypertension. These are the 2 main chronic illnesses.
Okay. So, I guess ideally, can you give us some numbers of how many you think you would need? Would that be something that you could draw up? Considering how many patients, and that was the other question that I think Brian asked. How many patients do you actually service within a year, would you say? How many are you seeing?
Well, a year roughly will be around 700. Okay. No, I think 700 is even a small number.
Yeah.
So let me check. 700 is quite small. Because a month we can get up to 150. So let's say the average number is 150, multiplying it by 12, that's around 1,000 and something a year. And then you are working with 2 SFIGs for such a population, you could imagine. Yeah.
Are these manual sphygmomanometers or the automatic?
No, the automated ones, the ones that just use it.
Wow. Okay. Does anyone else have? No, good seeing you. You look good.
Thank you.
Yeah. Thank you very much for arranging this. This has been very.
You're most welcome. You're most welcome.
Okay.
I know my boss. That's my boss right there.
Yeah.
He never says I look good, by the way.
Yeah. I mean, you got it there. Yeah. But I'm really happy to hear this. First, because a lot of this is what I have been reading and it's correlating very well. But the other thing is some more specific details of whatever you do need, because what we'd like to be able to do, like I said, is just to help you expand on what you have and be able to make it better. If that's coming, first of all, with being able to help you locate and be settled in a permanent building, that's one thing we can definitely help you to plan for. If it's coming to help you with the current situation, making the building more accessible or making it look better so the patients are more comfortable walking in. Again, happy to help with that as well. Okay. And then when it comes to all these little things, it's a little bit shocking. I won't lie to you to think that you're helping 150 people a month with 1 glucometer and 2 blood pressure monitors. Wow. I don't even imagine what that would be like here. Yeah. I don't think I would walk into that facility at all.
Right.
And at
the moment we don't even have a pulse oximeter to even work with. Yeah. So we are now planning on getting a pulse oximeter. It's got 12. Yeah.
Okay.
It was only 1 and now it's got faulty, I think 2 days ago. So we have to now get another.
Okay.
Plus the maternity unit, where the labor ward itself doesn't even have an air condition. So you can imagine the heat and then you are delivering. So all these are things that just kind of discourages them when they come.
So, yes. Okay. So if the thing about it, where would we be able to get the equipment to you? Because coming from here, obviously, I mean, we can get it from here, but that also be trying to ship in and get it to you. But how can we get it to you from where you are? Like, is there a source that you get most of your equipment from that we can help facilitate?
There are a few medical supply shops we normally go to.
Okay.
So we could get invoices from, let's say, about 2 or 3, and then we compare the prices, the least one, then we can pick from. With the inflation currently, I don't know whether outside you are facing the same thing, but with Ghana pound, almost every single day, there's a price hike. Yeah. So
Okay.
Once you go today, they can raise it up tomorrow. So you would have to check about 2 or 3 sources, and then at least you can find a balance between them all, and then you can.
All right.
Yeah.
So, Francis, can I come in here?
Yes, please.
Right. So, with regards to medical supplies, UATAD Foundation has been doing this for the past 10 years.
Right.
So we have medical supply companies and outlets or agents we've been working with for the past years. Because they know we work on charity, they try to.
Yes.
So, Nana, you cut off.
Yeah. Can you hear me now?
Yes. Sorry, go ahead.
Yeah. So because they know that we are a charity organization trying to help community, they always give us a budget that is way below the market value.
Okay.
And they look at it as something as like their corporate social responsibility. So they are also helping charity like communities through UATAD Foundation. So we have one of the suppliers in Kolebu. Kolebu happens to be one of our biggest hospital, Kolebu Teaching Hospital. Yeah. So anything like all the lists they gave, I ran it through that agent, the outlet, to see if the prices are good enough on the average market, and they were good before I sent the data to you. So anytime we are ready, we could just contact them. If it's funds that has to go to them directly, it will just go to them directly, and then Regina, my boss, will just go pick it up, or they will ship them over to the US. Yeah.
Okay.
Okay.
Perfect.
Yes.
And yeah, we're happy with that. That's a good plan. Okay, because we're more than happy to be able to get you the equipment as fast as you can, and as fast as we can as well. Because God, that's a lot that's easy. That really would be very helpful for you and turn around, I'm sure, a lot of things for you as well.
Very.
Yeah. But is there anything else that you feel that we can help you with? We're really open to everything and anything that you are willing to suggest that we can help you with. Like I said, we're a young organization, but we do have, we're all physicians. We all practice medicine here. And we've been in the game for a while. So we have challenges here in the United States as well when it comes to, providing rural health care, which I worked in and trained in for a number of years now. So we can all attest to the challenges that comes with, although the United States sometimes is seen as a beacon of advancement at times. It's very surprising the disparity in care that comes with certain places. And I'm sure Mike and Brian works in Kentucky. Mike, works all the way down in Texas. And he's well experienced as well, and we've all seen it. So what can we do for you that we can make sure that you can do what you keep doing? The fact that you haven't lost a single child as well for the last 3 years. Wow.
Yeah.
That's really something to be heralded. Seriously, that is impressive. So please tell us, what can we do for you?
Regina,
this is your opportunity. Please talk and stop disturbing me, boss.
I think one thing I would say is mostly we would want to, in terms of career prospects, we would want to advance our knowledge. So I don't know if there are some courses online that maybe you think can help us, especially with our staff, so that we can upgrade ourselves to the limit. Because mostly here you don't really have those access to those courses. So since you are there and then you are more advanced compared to us, if there's any course that is free or maybe the charges are a bit low, you could direct us to those places in order to upgrade our knowledges to serve the community better.
Yes,
Perfect.
absolutely.
Perfect.
Absolutely. Education is one of our fortes, so definitely, yes, we are more than happy to help with that. Okay, yeah. I know Regina was saying that she herself is a midwife, if I believe, or
Yeah, she's a midwife.
Okay, so we're more than happy to give whatever we can. Obviously, that's OB is not my specialty. I'm an internal medicine doctor. Mike is a pulmonologist as well as a critical care doctor. We can manage some things, and Brian is a family medicine doctor. He probably would be the specialist, but his wife is an OBGYN actually. Yeah, she's well practiced for the last decade. So yes, I'm sure she would be happy to be able to help educate as well as to help facilitate some of that as well, and kind of improve that knowledge. And then our big goal is also with the non-communicable diseases. So, like you were saying, hypertension, diabetes, and everything that comes along with diabetes. Diabetes is basically a blanket that hits everything. So we are very well aware of that, and that's one thing that we also want to help with you as well, to help address all of those things. Okay, a healthy population means a healthy economy and
Right.
happy state. Okay, so that's really something that we'd like to be able to do as well. So we'll put that at the top of our list as well. Okay.
Thank you.
Yeah, but
Regina.
yeah,
Anything more, Regina, please.
Regina.
is she
This
there?
is your only opportunity. She's right there.
It is not your only opportunity, I promise you. By all means. Yeah.
She keeps giving me pressure.
Yeah.
We need support. We need
You're
support.
telling me.
By all means, please. If there's more that you want, just like get like a count from your colleagues as what they would like to see improve, what they would like to see happen there, what hopes they have, how they want to increase and improve their ability to provide care. You are all very passionate. The fact that you're given care as good as you are, and also having to give away your ability to actually live as well, to even help people, that's something that we respond to very well. Okay, so whatever things that you would like to be able to put it all down, tell us now, of course, but if you think more later, put it all down, give it to Nana, and we're more than happy to be able to sit down with each other and try to make sure that we keep going over it and we get them one by one.
So I'm
So-
planning on having a staff survey next week. So I'll add that to some of the questions, and then once we get the majority, we'll pass it
Yes.
to get.
Okay. But yeah, we're hoping to be able to be start sometime this coming month to start to help you out with these things. So I know Nana is down there now, and he's helped form our not-for-profit liaison in connection with ours here, so that we can help to direct all the efforts through there in combination and collaboration with his group. Okay, so please feel free to, you have our numbers on WhatsApp. Feel free to text us anytime, give us any updates. What we really like is for you to be able to update us with each thing that happens so that we can put it on our website. We have lots of friends, we have lots of connections, we have lots of people who are actually very eager to see what we're doing here. And we're going to post this on our website so that they see what is happening. So whatever you need, please tell us. We will act on your behalf.
Okay.
Okay.
We'll do that.
Thank you very much, and
Oh,
please
thank you.
don't close this door on us, because we will be coming back to back. Nana can testify.
Every day.
Yeah, I promise you, we will not be doing that. My father actually is down there now, and this was kind of the impetus for me to act sooner rather than later, because he lives now there, and he unfortunately suffered a lot of the sequelae that comes with blood pressure. Now he's demented because he suffered from strokes, repeated strokes, also because he had a son that wasn't paying attention. And he was never a sick man, and unfortunately, I didn't pay enough attention to the things that really were not communicable. And unfortunately, he is what he is now. But I'd like to be able to make sure that the future generation does not suffer this. Okay.
Perfect.
So by all means, yeah, we'll not close the door. Keep this stream open, and we'll make sure that we get everything across to you.
Thank you so much. Thank you.
Guys, did you guys have anything else? Mike, Brian?
No, but I would like to stay on afterwards with you, Frank, and just kind of.
Definitely. Thank you very much for your time. Okay.
Thank
We
you
can
so
get back
much.
to you as soon as we can.
Absolutely.
Thank you
Yeah.
so much.
Thank you.
Thank
Madasta.
you.
Thank you.
Bye.
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 I'm not ticklish, man.
Nana, I understand it's our body and what's it.
Make sure bye yeah, be more money. It's all about why. Bye bye.
Bye, guys.
Bye.
Okay. And who's Mavis? I don't know who Mavis is.
Not sure.
Yeah. Okay. There you go.
Damn.
All right.
Let's go get. Do you have your shoes on?
Yeah.
Okay.
So one of the things I was thinking, Frank, I think the eventual goal to
Yeah.
get them a new place is commendable, but I do think that for our due diligence